Whenever I tell my patient that you have been diagnosed with GCT or giant cell tumor of the bone, the first question they ask me is as to what is GCT? Is this some kind of a cancer of the bones? Is surgery a must for treating giant cell tumors? And the most important question, whether GCT can be cured. Hello everyone, welcome to Bone Cancer Clinic Chandigarh, an exclusive orthopedic oncology clinic. I am Dr. Rajat Gupta, orthopedic oncologist, and in this video I will be talking about the symptoms, causes, treatment options and other frequently asked questions on giant cell tumor or GCT of the bone. For more information, you can also log into our website www.curebonecancer.com. Coming to the first question as to what is giant cell tumor, this is a benign or non-cancerous bony tumor which occur at bony ends near the joint. It's commonly seen in patients after they have attained skeletal maturity, that is, after they have attained complete height. It affects young adults between the ages 20 to 40 years. Next question which comes to mind is, what are the symptoms of GCT? Well, the most common symptom is pain, which over time gets worse and continuous. Many a times, patient may be experiencing pains for months altogether before he visits a specialist. Along with pain, patient may also complain of swelling of the involved bone. Since the bone which has been eaten up by a giant cell tumor is weaker than the normal bone, it may fracture without any trauma or minimal trauma like fall from bicycle, missing a stair, etc. This kind of fracture is called pathological fracture. This is a case example of a young lady who had giant cell tumor of the knee joint, but she somehow ignored her symptoms, and by the time she presented to us, she had pathological fracture following slip at home. So it's advisable not to ignore your symptoms and seek medical advice at the earliest. Another common question which my patients ask me is as to what causes GCT. Well, as of now, there are no known environmental or hereditary factors which cause giant cell tumor. Next question is, how is GCT diagnosed? After thorough physical examination by the clinician, a patient is subjected to a battery of tests which include X-ray, MRI, biopsy, and so on. A simple X-ray tells us about the extent of involvement of the bone. Like in this case, we can see the giant cell tumor has eaten up the lower part of the thigh bone in this patient. In addition, X-ray also tells us about any obvious or impending fracture. After X-ray, the patient is subjected to the MRI of the bone, which helps us to clearly delineate the extent of the lesion. In addition, it also tells us about the involvement of surrounding muscles, etc. Further, MRI also helps us in planning biopsy or definitive surgery for the patient. The most important investigation in the diagnosis of giant cell tumor is biopsy, in which a part of abnormal bone is taken and is sent for testing under the microscope by the pathologist. The process of taking abnormal bone can be done with the help of a surgery which requires incision, stitches, hospitalization, etc. and is called open biopsy. However, a more convenient and patient-friendly way to obtain this abnormal tissue is with the help of a needle, and it's called needle biopsy. As compared to open biopsy, it avoids any major incision and hence patient has no or minimal pain. In addition, it can be done as a daycare procedure and hence it avoids hospitalization. And the most important benefit of needle biopsy over open biopsy, which has an impact on oncological outcome as well, is that needle biopsy causes much less contamination of the normal tissue. There are few myths associated with needle biopsy, the commonest being that FNAC and needle biopsy are the same investigations since both are done with a needle. However, FNAC and needle biopsy, they are two different investigations, and unlike other cancers, FNSC has no role in the diagnosis of giant cell tumor. After the diagnosis of giant cell tumor has been made, the next question which comes is, how do we treat it? Well, surgery forms the mainstay of treatment in vast majority of these patients. However, certain patients like giant cell tumor of the backbone, sacrum, etc., where surgery is either not feasible or is too risky, non-surgical options can be considered in those patients. Coming to the kind of surgery being done in giant cell tumor, well, it depends on number of factors like the type of bone involved, extent of bony destruction, presence of any fracture, condition of the nearby joint, number of surgeries done prior if any, that means whether this is a newly diagnosed case of GCT or the tumor has come back following initial surgery. Based on these factors, giant cell tumor can be treated with surgery in the form of extended curettage or resection. In extended curettage, the tumorous bone is cleaned with the help of curettes and high-speed burr machine, and the defect so formed is filled either with the help of bone cement or with the help of bone graft. If we compare bone cement with graft as a filling material, cement has the advantage that it allows immediate weight bearing or functional use of that limb. In addition, filling with cement has the advantage that it helps in early detection of local recurrence. Moreover, when the cement sets, the heat generated kills the tumor cells, and it's proposed that filling with cement has lesser chance of tumor coming back as compared to filling with bone graft. In addition, since bone cement is available off the shelf, we need not do any surgery to harvest the bone graft, and hence there is no donor side morbidity when we use cement as the filling material. With the above advantages, it may seem as if cement is the ideal filling material, but then bone graft is more biological or natural. In addition, there have been concerns raised about the heat generated while cement sets in tends to cause early damage of the joint. So, you need to consult your doctor and discuss which material suits best for you. Just to show you few examples, this is an X-ray of 20-year-old male with giant cell tumor of the knee which has been treated with extended curettage and cementing. This is his X-ray and this is his function. You can check out the results of another patient treated in a similar way by clicking on the link above. This is another patient, 35-year-old male with giant cell tumor of the elbow, which has been treated with extended curettage and bone grafting. In some patients, the tumor has increased so much that it is not possible to save the joint with extended curettage. In those patients, resection is done, in which a tumorous bone is removed without cutting the limb, and the defect so formed is reconstructed with the help of artificial implant called megaprosthesis. Sharing another example of 55-year-old lady with giant cell tumor of the knee who had been ignoring her symptoms for quite some time, and by the time she presented to us, her disease was too big and she underwent wide resection and reconstruction with megaprosthesis. To check out her results and her story, you can click on the link above. Giant cell tumor in certain bones do not require any reconstruction after resection, which include the upper end of the fibula, which is the small bone near the knee joint, also upper end of the radius, that is near the elbow joint, and lower end of ulna, which is the small bone near the wrist joint. Here is a case example of giant cell tumor of the lower end of the ulna, which has been treated with resection only without any reconstruction. You can check out the story and functional results of this patient by clicking on the link above. Moreover, there are certain bones in which after resection, reconstruction is preferred with bone, which include lower end of the radius, that is near the wrist, also lower end of tibia, that is near the ankle. This is another case of giant cell tumor of the lower end of the radius, that is the wrist bone, which has been treated by resection and reconstruction with the opposite small bone, that is ulna. You can check out the functional results of this patient by clicking on the link above. Though surgery is the mainstay of treatment for giant cell tumors, in some patients, surgery is either not possible or is too risky. In those patients, non-surgical options can be tried. However, the indications for these are very limited. Examples include giant cell tumor of the backbone or spine or sacrum. Non-surgical options include angioembolization, radiation therapy, zoledonic acid or denosumab, or combination of these. Injection denosumab can also be given in some patients prior to surgery. And now, coming to the most important question, whether giant cell tumor can be cured. Well, with the current surgical techniques, giant cell tumor is curable. However, it has a tendency to come back in 10 to 20% of the patients, and hence, once diagnosed with giant cell tumor or suspected to have giant cell tumor, one should consult a specialist dealing in bone and soft tissue cancers. He is called orthopedic oncologist or musculoskeletal oncologist. I hope most of the queries related to giant cell tumor have been answered by now. For more information, you can log into our website www.curebonecancer.com. You can also follow us on our Facebook page Bone Cancer Clinic. For more videos, you can subscribe to our YouTube channel, the link given above. You can also WhatsApp your queries on 99303 72264. Thank you.